and they buy out these big call centers. There's one out of St. Louis that really drives us crazy because they send their agents down here and they go after the Medicaid people and just really take advantage of them. And it drives us absolutely crazy. But a lot of times those call center people, they aren't licensed, which is illegal for them to make phone calls if they're not licensed. It's also illegal to cold call people on Medicare Advantage just in general, but they do.
Welcome to In Good Company.
Today, we're talking about something that almost every American family will face sooner or later, Medicare. For many people, turning 65 used to be pretty simple. You enrolled in Medicare and that was that. But today, the system is much more complicated. Seniors are being asked to choose between traditional Medicare, Medicare Advantage plans run by private insurance companies, prescription drug plans, and Medicare supplements. At the same time, Medicare Advantage enrollment has exploded. More than half of all Medicare beneficiaries are now enrolled in these private plans, and the number keeps growing year after year. Supporters say Medicare Advantage offers lower premiums, extra benefits like dental and vision, and coordinated care. Critics, on the other hand, argue that some plans restrict networks, require prior authorizations, and sometimes delay or deny certain types of care. So, how should seniors and their families navigate all of this? Well, today we're talking with Adam Kyle with Kyle Insurance, a Medicare insurance expert, to help us understand how the system really works, how to choose the right plan, and what questions every family should ask before making a decision that could affect their healthcare for years to come. Adam, welcome to our show.
Hey, thanks so much for having me.
So glad you're here, Adam. We get so many questions about Medicare, and in the old days, people would just go out and sign up for Medicare because that was really the only option. And so today, there's so many choices. People are really confused right now. Can you help explain what the difference between traditional Medicare and Medicare Advantage is?
Yeah, sure. I'll give you the summarized version. And original Medicare is Medicare Parts A and Part B. Medicare Part A is hospital insurance. Part B is medical insurance. I don't like those terms because they're too ambiguous. So the terms that I like to use are inpatient for Part A and outpatient for Part B, because I really think that really captures more of what each one covers. Part A, really anything that involves overnight care is going to be covered under Part B. So that includes inpatient hospitals, skilled nursing, hospice, overnight home health care, as you guys well know. Part B is going to be essentially everything else except for drugs. Most drugs, but doctor's office visits, blood work, MRIs, emergency room care, and sometimes if you do stay overnight in the emergency room, they'll bill you as under observation, which would fall under Part B because legally they can do that for 48 hours. But original Medicare has a lot of downsides. The upside is, for better or worse, it's a one-size-fits-all health plan for the entire country. So CMS, which is Medicare, does not have the manpower to really police prior authorization. So a lot of them are automatic. The other upside is you can go anywhere that accepts Medicare assignment, which is essentially any major hospital in the country. The only exception would be private alternative clinics that do not accept insurance assignment at all. And Medicare Advantage, on the other hand, let me back up. The other big downside to original Medicare is Medicare Part B has a small deductible. This year it's $285. But after that, it's got a 20% coinsurance. And so that means you pay $285 plus 20% of whatever else you have that's billed as outpatient. So that means you could go rack up $100,000 in outpatient costs. And unfortunately, in this day and age, that's not really all that difficult to do. Your out-of-pocket costs would be $20,285. There's no cap on that, no maximum out of pocket. There's no stop loss limit. So you just continue racking up that 20% and ad infinitum. That's where the Medicare health plans come in. And Medicare Advantage is Part C of the Medicare program. And it includes Medicare Part A, Part B, and Part D. You may notice that when I was talking about Medicare, original Medicare, I did not mention drugs because original Medicare does not cover drugs. At least drugs you would get from the pharmacy. If you go to your doctor's office to get a shot or something, then it would be covered. But Medicare Advantage is run by private health insurance companies. It's a union between the health insurance company and the government, CMS. And what that does is how that works is the government pays the insurance company, the Medicare Advantage plan, to take over your Medicare benefits. We don't like to use the word replace, but you can kind of conceptualize it that way. You're still enrolled in original Medicare. You got to keep that red, white, and blue card, but the government is no longer being billed. The insurance company is being billed. Now, Medicare Advantage has to cover everything original Medicare does. And a lot of times, at least in this area, it covers it a little bit better. So let's say, for example, instead of paying 20% after your Medicare deductible, Part B deductible, to go see a specialist, you might pay $30 on a Medicare Advantage plan. Medicare Advantage also usually includes drug coverage. We call those MAPDs, Medicare Advantage Prescription Drug Plans. There's also a maximum out of pocket. So there's a certain limit to what you can spend on your Part B, Part A, and Part B coverage throughout a year. Let's say in this area, it might be $3,500. That's a pretty good median for this area. It also includes some things that original Medicare does not cover, like dental, vision, hearing, over-the-counter drugs. Last year, there was a plan that would give you $50 a month for healthy groceries or $150 a quarter for utility bill payments. So that's really a long-winded short version of what original Medicare and Medicare Advantage is, respectively.
Yeah, you can't hardly turn on, like, open a magazine or look at a billboard or turn on the TV without seeing some famous person or semi-famous person selling Medicare Advantage. It seems like there's a lot of money going into advertising.
Joe Namath in 2020. Every time I saw him, I wanted to hit him in his perfect teeth because they just played that over and over and over.
Yeah, that is a sizable marketing budget. How do you think Medicare Advantage can afford to pay for all these Medicare services and cover all the costs? Because as I understand it, they get paid relatively the same as traditional Medicare.
Well, that used to be true. Medicare Advantage used to be more efficient for the taxpayer. Now, at least the last number I heard, it costs about 15% more annually for the taxpayer to pay for Medicare Advantage than it does original Medicare. But when it comes to these marketing budgets, you usually have these giant entities called super FMOs, field marketing organizations, that are paying for these commercials and this advertising. And that's like the celebrities that you would see on TV. That's who's paying for these. And the shocking thing that what might be shocking to hear is that usually those commercials are not Medicare compliant. They are not compliant with CMS's marketing guidelines. And it's subtle enough to where CMS, it kind of falls under their radar until 2021, when it just became crazy and Medicare finally had to step in and say, you gotta
stop offering people brand new cars when they're not going to give them a brand new car.
Practically. It was just under that. It's been crazy what they're offering.
Yeah.
But what they are generally offering is what we call dual special needs plans. And those are for people on Medicare and Medicaid. So if you see one from an insurance company, they're going to offer, like, we can get you money back on your Social Security check. We can get you, $5,000 in dental and money every month for groceries and utilities. Well, the average Medicare Advantage plan does not cover those things, but the dual special needs plans do. They know that 90% of the people that call in are not going to qualify because they're not on Medicaid and they're not on the right level of Medicaid either. But once they get you on the phone, they might say, well, how would you like $2,000 in dental instead? Well, who was going to say, no, I don't want $2,000 in free dental, which they're not allowed to use the term free either anyway, but they do regardless. But a lot of times what'll happen is they'll switch your plan without telling you they're switching your plan and without checking your drugs and without checking your doctors to make sure they're all covered. So there's a lot of money in Medicare Advantage. And the higher up you get in the sales chain, the more money you get. So for example, if, let's say, my FMO out of St. Louis, they might get, the guy at the top, he might get, let's say, $100 per policy in overrides. Well, if you're the head of a region and you've got 5,000 agents working under you in the fall during the annual enrollment period, that's a bunch of money. And a lot of that doesn't go into his pocket. It goes into their marketing budgets. And that's really kind of how they're paying for all of this. So, and they buy out these big call centers. There's one out of St. Louis that really drives us crazy because they send their agents down here and they go after the Medicaid people and just really take advantage of them. And it drives us absolutely crazy. But a lot of times those call center people, they aren't licensed, which is illegal for them to make phone calls if they're not licensed. It's also illegal to cold call people on Medicare Advantage just in general, but they do. I don't know how much the call center people get paid, but they're not getting paid a commission from the insurance company. They're getting paid from the call center. And it's not the full Medicare Advantage commission. It'll be a smaller chunk of that. But, if you're a college student or just fresh out of college and you need some quick cash, you get, a day of training in Medicare Advantage and you're told to, hey, go call people, tell them you got this and switch their plan.
Yeah. We have a home health, hospice, and home care agency. And every year we have people that at the beginning of the next year, they're changing insurances. Mm-hmm. And there's always a percentage of those that had no idea that they were changing plans. Mm-hmm. And somewhere along the line, somehow, some way they got switched. And we even have their kids, they'll like, we have no idea. I didn't do it. And they're like looking at each other and the individual doesn't know how that happened. So what's some good advice for families or individuals that might be tempted to pick up the phone and make a 1-800 call to one of these, what was the acronym again? It was
super FMOs.
Super FMOs, yeah. Because
call center is a good way to do it too.
Call center, they may risk potentially giving their information and getting switched without wanting to.
Yeah. Never give out your Medicare number over the phone. Because that's the one piece of information that they need to switch your plan.
Okay.
They need a couple others easily, but the couple others are public record. Your Medicare ID number is the one piece of information that they cannot get from anybody but you. So do not do that. Do not give out your date of birth or your phone number. Those again are public record anyway, but you just make their job a lot easier when you do it. So don't do that. And as an individual broker, an independent agent, I say shop local because, we have all the plans you can want here. There's only a certain number of plans, so Medicare Advantage plans and prescription drug plans in a zip code. And an individual broker is going to have most or all of those. So consult with somebody who knows the region real well, who knows whether or not you're getting your leg pulled.
Right.
Or make sure you know exactly who you're talking to. Like if you have, let's say you're on a United Healthcare plan and you don't have an agent or a broker and you get a call from United Healthcare and they say, they look at your medications and say, oh, you might qualify for a chronic special needs plan. They might be serious. But just make sure you know it's United Healthcare you're talking to.
Right. So, we're avoiding giving out our Medicare number, but we're wanting to shop local here in this area in the Southwest Missouri. If you, like, let's say you're an adult child and you've got parents that you're trying to look out for and you're Googling, how do you know that the number that you're looking up is an actual number that's to a local agent? How does somebody determine if they're a local agent or if this is going to feed through one of these big super
if the marketing groups? And by the way, let me make something clear. Not all FMOs do shady things.
Sure.
There are some that, they train and contract individual brokers like myself. And, my FMO, I love my FMO. They're great. They're a big help to me and to my clients. But you're right. It's not as simple as finding a local phone number anymore because those could be ghosted super easily. The number one thing I would do is I would look and see if they have a physical address that you can go to, an office that you can go to. And even that is not really a great indicator because a majority of individual brokers don't work out of an office. They might have a home office, but they meet all their clients in their house or they meet them at, McDonald's or a coffee shop or something like that. But make sure you can see reviews of them. That would be one of the number one things that I would look at. Or talk to your friends, see who your friends use. Say, hey, do you have a guy locally that you like?
Yeah.
And that would be, referrals are the best way that I get clients because, if somebody trusts me enough to refer somebody to me, I know they're probably going to be pretty loyal.
That's awesome. Okay, so many people hear the term Medicare Advantage and assume they're simply getting Medicare. But technically, they're handing their Medicare benefits over to a for-profit company. What are the fundamental things that are essentially different that are going to be kind of the biggest issue that some people have if they pick Medicare Advantage and they thought they were getting traditional Medicare?
Yeah. Well, first of all, if you have an agent or an agent or broker that is being compliant, the difference between an agent and a broker is an agent is captive with an insurance company. So if you're an agent with Humana, you can only sell Humana. A broker is going to be somebody like me that represents multiple carriers. So, an agent, a good agent or a good broker should have told you and made it very clear that you're signing up for a Medicare Advantage plan, not original Medicare. Or a Medicare Supplement, because to a lot of people, they say Medicare Supplement, but they want what their brother or sister has, and it's a Medicare Advantage plan. To a lot of people, a supplement is a catch-all for a Medicare health plan. But we have to be very careful in making sure that those are distinct in their mind. But the number one thing that I would make sure they understand is that this Medicare Advantage plan is a network-based plan. So you've got HMOs, you've got PPOs. Meaning you have to stay within network, or in the case of a PPO, if you go out of network, you have that option, but you're going to pay more, and you have a higher maximum out of pocket. To some people, that's a deal breaker, but honestly, to most people who have been working their entire career and on a group health plan or on the marketplace by any chance, a Medicare Advantage HMO is probably going to be a lot more flexible than a group HMO. For example, I'm on a plan through the marketplace, and I had to switch because my plan, there are no plans in Greene County on the marketplace that have Cox in network anymore. And I saw Cox doctors. So I had to switch, and I wanted to go up to Barnes Jewish, and nobody has Barnes Jewish in network anymore. Well, a lot of that Medicare HMOs in Greene County have Cox and Mercy in network. So it's an HMO, and they have both hospital systems in network. They have Barnes Jewish in network. They might have KU in network. Up until this year, a lot of the PPOs had the Mayo Clinic in network, but the Mayo Clinic has decided they don't want to do any business in Missouri anymore. So you could still go to it, but you're going to be paying out of network prices if you're on a PPO. That would be the first thing that I would make sure they understand. The second thing I would make sure they understand is that unlike original Medicare, you have an insurance company making coverage decisions, and that's a big deal. Like I mentioned a few minutes ago, Medicare is a one-size-fits-all plan for the entire country, and we're a big country, so they don't have the manpower to police prior authorizations. A lot of it is just automatic. And with insurance companies, that a lot of that is similar, and they have to follow Medicare's guidelines, but they have their own interpretation of those guidelines a lot of times. And Medicare leaves the door open for prior authorizations. I listened to your last podcast about prior authorizations, and they brought up some great points that, especially, I think the number was 80% of all appeals get approved. And that is true. You just have to know how to fight it. Yeah, on a Medicare Advantage plan. I think I could name on one hand, I've been doing this for 11 years, and my book of business is overwhelmingly Medicare Advantage, not by choice, but just people want to go that route. I think I could name on one hand the number of times we had to appeal something more than once and it didn't get resolved. Now, that's just me. Yeah. I'm sure a lot of people have had a heck of a headache with getting something done. But, in my experience, my limited, but, 11-year experience, this area is a good region, and the insurance companies here, will work with you more often than not. But the best insurance company is still an insurance company. They're out to make money. So that's something you have to keep in mind.
So you have folks that come to you for traditional Medicare, but you mentioned this 20% co-insurance. Mm-hmm. Do they all just pay that 20%?
Well, almost. I think I've had one person that has come to my office to get on Medicare that chose to stay with original Medicare and not add a supplement or get an Advantage plan.
Okay.
Because if you add a Medicare supplement, you don't really have to worry about that 20%.
Okay.
So I have a lot of people that come in and they want to add a supplement, but I think one person maybe in 11 years that I've been doing this that said, no, I just want the drug plan and I want to stay on original Medicare and not add anything.
And so what does this supplement cover?
Well, it depends on what kind of supplement you get. The supplements they've been around almost as long as Medicare's been around. And the pros to Medicare supplements are you get really all the benefits of original Medicare, meaning you can go anywhere that accepts Medicare, and you really don't have to worry about prior authorizations. Now, you have an insurance company involved, but Medicare supplements are a secondary payer to original Medicare. So that means if Medicare approves it, legally, the insurance company has to pay it. And there are several different kinds of Medicare supplements, but the most popular kind, in my experience, is the Plan G. That's kind of like the Cadillac Medicare plan, the one that if everybody could afford it, they would want. And with the Plan G, you're only out of pocket for the year as far as your medical costs are concerned is that annual Part B deductible, which goes up a little bit every year, but this year it's $285. And after that, you have 100% coverage for your medical costs. So if you've paid your Part B deductible and you want to go to the Mayo Clinic, you don't have to check and see if it's in network. You pick up the phone and call and make an appointment. And then as long as it's Medicare approved, you will pay $0.
That's great.
Yeah.
That's great. So let's talk about how a broker, since you deal with so many different Medicare Advantages, how you determine what's right for your clients. And I know that you can talk about maybe the financial differences, but I think what I'm also interested in is there are definitely big differences between the Medicare Advantage plans. There's some that are, well, from a provider standpoint, pretty easy to work with, and some that are really difficult to work with.
I'm curious to see your opinion on the new plan that's in the area. I don't think I can say it on air on a podcast, but
I think I know which one you're talking about.
you probably do. I've heard some horror stories.
Yeah, and I think some of those horror stories have to do with just putting the right procedures in place. Because what the problem from a provider's perspective, what we run into is that we'll get a new plan and there's all these new rules and how the rules actually play out. And there's a lot of legalese with these rules. So you think you understand what the rule is, but it's worded in a way that it could go 100 different directions. And so we have to pivot to figure out what the right thing to do is. And to be honest, I can see why providers would have an issue with that particular plan that you're speaking about, because I know exactly which one you're talking about. We have one, and I'll just kind of deviate just a little bit just to kind of help describe some of the hoops we have to jump through. We have a particular Medicare Advantage plan where we have to ask for authorization. We can get the authorization for 1 to 2 visits right up front, very easy, very quick, almost sight unseen. They're like, here, take your first 2 visits. Then they want us to send in the documentation from those first 2 visits. And then they have somewhere between 5 to 14 days to let us know if we're going to have additional visits or not. Well, one of the issues that we have run into is that some people can't wait that 5 to 14 days. And so we have to make a decision as a company of whether or not we can provide those or not. And now they've changed the rules so that they give you dates of authorization. So we used to just go ahead and see that patient and just continue to see them and risk them saying no.
Ask for forgiveness.
Ask for forgiveness, yes. But now what they've done is they've said, okay, we're going to authorize between these dates, but that date doesn't start until they actually give you the authorization. So if you provided visits between when you're kind of seeing where I'm going with this. So we're stuck. We really do need to provide more visits for them, but we're definitely not going to get paid for those visits. That is a guarantee. So we hope that they're going to get back to us quickly, and we have a whole team of people that do nothing but do this as rapidly as possible. But legally, they don't have to get back to us right away. And so in traditional Medicare, let's just use this as an example. If somebody had a stroke, for instance, and they came to us, most of the time they need relatively intensive therapy.
Yeah.
And so it's not a lot to ask to say, we're going to provide, say, 20 visits in a 60-day period. It's about 2 visits a week, maybe just a little bit more in a couple of weeks, but more or less 2 visits a week. Well, with this other insurance, regardless of diagnosis, it doesn't matter whether they need it or not. The best we can do is maybe a visit a week, if not 1 visit every 2 weeks.
Yeah.
It's not enough care for those individuals. And it really puts us in a position, and any other provider out there, in a position where we don't really have a lot of choice. And even if the doctor said they absolutely need 2 visits a week, and we say we absolutely need 2 visits a week, it doesn't matter. The way they've set up the process, which is completely legal, has made it so they can provide half the number and less than half of the number of visits in that 6-day period. It's a great savings for them.
Yeah.
But I would argue that it might not be a great savings, because some of those people end up going back to the hospital.
Yeah.
And you're like, I don't understand the logic here, but that's, those are the
funny
hoops
is
that they go
so
through.
many of those extra benefits are designed to keep the beneficiary healthy that they're paying for. Like Silver Sneakers, for example, is designed to keep a beneficiary healthy and out of the hospital. But it's like, okay, but when it comes down to it, you're not keeping them healthy and out of the hospital in issues like in situations like this.
Yeah.
Yeah. I mean, it's in an ideal world, care would be between, or decisions about care would be between the provider and the patient. And part of me understands where, and again, don't mistake me for a shill again for the insurance companies. I'll talk, pardon my French, I'll talk crap about it.
Truth
Come to my office.
We appreciate that. We need honesty.
Yeah. We'll talk about, who's made me mad that week. But part of me understands where the insurance company is coming from, because take the case of Medicare medications, for example. For 90% of the people, if a doctor prescribes a name brand drug and there's a generic available, 90% of the people, the generic's going to work just fine. But, and there's mechanisms in place for the doctor to say, well, no, we've already tried this and it doesn't work that fine, or work just fine. And sometimes it takes a little bit for the insurance company to be like, oh yeah, you did. We looked through your file and you did try that. And so, all right, we'll approve it. And, if we're being honest, doctors are overrepresented for sociopathy and narcissistic personality disorder compared to the general population. And so you get these doctors with God complexes come in and they order a bunch of expensive medications just because they were expensive procedures, because they want to see what happens and see how much they can get away with. Does that happen all the time? No, not all the time, not anywhere near that. But it happens enough that if I was an insurance company, it would make these pause. But again, it's just not enough to justify them doing what they're doing. And especially, and CMS is cracking down on this, and I'm so glad, even though it means that it makes my life harder. There's so much fraud, waste, and abuse in Medicare Advantage. And you might be surprised, but you'd be surprised who the number one offender is. I don't know, maybe you wouldn't. If you've dealt with them before, you probably wouldn't. But in fact, I think I know who you were talking about just a little bit ago when you were talking about the prior authorizations. But there's just so much money in this world, in the Medicare Advantage world, that there's really no excuse for this to be happening. And from my perspective, so you read my article about the Inflation Reduction Act and how much that's changing things. And so one of the main things that it did was it decreased the catastrophic coverage limit for beneficiaries. It used to be, there was no limit. Once you got to catastrophic coverage, you were out of the donut hole. You paid 5% of the total cost of the drugs for the rest of the year. So if you'd spent $8,000 on medications already, that you still weren't going to hit zero. In 2024, it was 8,000. So if you spent 8,000, you were finally good until January 1 again. And then in 2025, it was 2,000. So it went from 8,000 went from zero, no catastrophic limit, to 8,000 down to 2,000. And that was because of the Inflation Reduction Act. Now, who's picking up the cost for that? Just, the rest of the cost of those drugs? Well, 60% of it's coming from the insurance companies themselves. 20% of it is a forced discount from the manufacturers, but still 60% of that is coming from the insurance companies. And so they're cutting a lot of benefits. We're seeing drug deductibles go up. We're seeing max amount of pockets go up, but really one of the main things that we're seeing go up or be eliminated or slashed is the extra benefits along with Medicare Advantage. And I'm going to be honest, I'm not really all that upset about that, because in the last, especially the last 6 or 7 years that I've been doing this, so many of the people that have come into my office in the fall, when it's time to choose a plan, it comes down to who's got the new toy, who's got the shiny new thing.
Yeah.
There was an insurance company 2 years ago. They were offering, I'm not going to say the amount because I don't think I can, but they were offering an absurd amount of money in fitness reimbursement, meaning as long as it was peripherally related to fitness and it wasn't a gun or it wasn't clothes, you could buy it and the insurance company would reimburse you for it. So I'm talking Apple Watches, I'm talking kayaks, I'm talking tents, bow and arrow. I think you could buy one of those. And of course it was cool. And it's not that I don't want my clients to, take advantage of that stuff, but it's like, really? If your health insurance company is buying you an Apple Watch or a kayak or a bow and arrow, probably a sign that this is unsustainable. This is getting unsustainable.
Yeah.
And of course that went away the next year because it was a nightmare I'm pretty sure that a week before their bids had to be in for their plan designs for the next year, some suit said, hey, we've got this money to deal with. Let's throw this in there. And they spent, I don't know, all of 5 minutes coming up how they're going to manage that benefit. And it was a nightmare. It was way too open-ended because anytime somebody submitted a receipt and the claim form, they were like, we have to check and see if this is covered, if this is eligible for reimbursement, because it was so open-ended. There wasn't really an exhaustive list. It was like, as long as it's related to fitness. And then this is hilarious. CMS made this insurance company in March, no less. So 3 months into the year, said you have to stop paying for tennis shoes and bicycles. I think it was bicycles. It may have been fishing rods. I don't know. I don't remember. That is the only time I've ever seen CMS step in and say, no, you cannot do this midway through a plan year. If they've done that, it's been for the next plan year. Say, okay, well, yeah, this is really hard. Next year, you can't offer this. But 3 months into the year, they stepped in and said, no, you can't do this anymore. And I asked our rep, like, okay, why are they not allowing you to do this? And they said, well, other people with other insurance companies were calling their insurance companies, complaining to them, and the insurance companies complained to CMS, and CMS was tired of getting the complaints and told this insurance company they could not pay for these things anymore. Yeah. And so that was just wild, but that is a perfect example of how unsustainable these benefit structures are.
Yeah. I
had a meeting with one of my reps the other day. They're a really good company based out of St. Louis, and we like them a lot, at least in our experience. I called them about a contracting issue a couple of years ago. I was on and off the phone in 5 minutes, and that doesn't happen when you call an insurance company about a contracting issue. I blocked an hour off to be on the phone with them. But she had said, we never want to be the best plan and we never want to be the worst plan, because that right in the middle, that's where it's sustainable. That's where we can keep consistency. Yeah. I'm like, thank God. Yeah. Thank you so much. Yeah. It makes my life so much easier. But it's just in the last 6 or 7 years, the competition in Southwest Missouri has been who's got the shiny new toy. Yeah. And I'm really not all that upset to see the benefits getting back to being about the healthcare, because that's what Medicare Advantage should be about. Silver sneakers, I get. Dental, I get. Those things I get. But the fitness reimbursement, the Apple Watch thing, come on.
Yeah, an actuary who's in one of these companies is going to look at this population, and they're going to go, how do we capture as much of this as we can and optimize the most that we can? And so legally they can change the plan every year. Mm-hmm. So they're like, okay, we've got to sustain this for X number of days or years or whatever. Mm-hmm. But the more I look at it, the more I'd say it seems like a Ponzi scheme, but it almost seems like a Ponzi scheme in the sense that the more members that they can pull in. And now some of the companies are optimizing by doing specialized testing so that they can add particular diagnosis and up the coding, so to speak, legally up the coding, because they got in trouble for not legally upping the coding for a while. And so I think the big thing is that we're trying to help our audience understand is how much buyer beware is out there. And so if you went to go to a car dealership and there were two car dealerships right next to each other and they had the exact same car, and one of them said, hey, we'll not only give you this car, but we'll pay for your rent for a year. Then you're thinking there's something wrong with that car. But I don't think people understand that money is not endless. And that even though Medicare Advantage does cost the taxpayer more, it's not that much more. And when you look at the profit margins of some of the insurance companies and how top heavy some of them are, you start to wonder like how sustainable it really is. And I want people to land with a good Medicare Advantage plan that ultimately at the end of the day just pays for their medicine, their medical needs. And they're not going to put the providers through hell, because those providers will say no eventually. And they're doing it all over the country. Like there's whole hospital systems that are turning their back on certain plans because they're just tired of being put through the ringer.
And there's one company in particular that it's happened here. Last year, there was a whole bunch of drama with Mercy in this insurance company. In fact, I wrote a opinion piece for the journal on there, for the business journal on that one. But it's not just this area, it's a lot of places. A lot of places in the country are not working with this insurance company anymore. And, to answer your question about how I help someone choose, I look at a few different things. And if we're strictly talking Medicare Advantage, if they're already on one, or if they've made up their mind that that's what they want, then if they are, a lot of people turning 65 coming to my office are relatively healthy. And so at that point, it's like, if you're not taking any meds, if you don't really see a lot of doctors, then we can look at the one that's got the best extras, because really that's what you're going to be using if you use any of it at all. I always warn them though, that like a plan that is good this year may not be good next year, or at least good in the way that you want it to be. They might have $5,000 in dental this year, but they may slash it to the bone next year. So that one plan that was offering like $50 a month for healthy groceries. I just had a lady in my office right before I came here. She didn't read her annual notice of change or come to any of my meetings, but so she didn't notice it until now that they had taken away a lot of stuff that she liked. And so we had to find another plan, and she depended on that. She made her budget around that $50 a month for groceries. And when you buy a business, that's sad when you do it that way. But if you don't have any health issues, or you don't see the doctor that much, then by all means, go with the shiniest toy. If it's not the case, which the case for most people are on medications. Most people see a couple doctors every time, or several times a year. Then the first thing I look at is, which network do you use? Are you Mercy or Cox, or do you CMH, which uses both networks? So it's really not an issue there. That narrows it down. If you see Mercy, you have more options in Southwest Missouri, because Cox is stingier with their contracts with the Medicare Advantage plans. But still, a lot of the leading plans have both in network. There's one plan that is a Mercy sponsored plan. It's a local plan, and it's got the most competitive medical benefits, and a lot of people want that. If you see Cox doctors, you're out of luck. But if you see Mercy doctors, great. Then the next thing I do is I look at your medications, because a plan may have all of the best extra benefits and the most competitive health benefits. If they don't cover your medications, that really doesn't do you any good. Especially if you're on one of these high dollar medications like Eliquis or Jardiance or Xarelto or any of those, which those are going to get better because the Inflation Reduction Act allowed CMS to negotiate with the manufacturers for better prices on those. And there's another 20 or so that are going to be negotiated for 2028, starting in 2028 to get lower prices. But anyway, that's the next thing I look at. And if you are a high utilizer, meaning you take a lot of medications and you see a lot of doctors, we really can just stop and end there. If they cover your doctors and whoever comes up best for your medications, it's kind of the end of story. I've got a tool provided to me by my FMO that allows me to go in, create a profile for somebody, enter in their medications, their doctors, and it will sort every plan in their zip code from lowest out-of-pocket cost to them annually to highest out-of-pocket cost to them annually. And so really the top one, if it's significantly cheaper than the next ones, then that's the one I recommend.
Yeah. So I've got to ask this, and you don't have to get into specifics here, but is there a significant difference in reimbursement to the broker for Medicare Advantage versus a supplement?
No, not really. The pay schedule is a little bit different. And I won't go into this too much because I've tried to explain how the commission schedule works with my financial planner and he doesn't even get it. My financial planner, he's a trooper. If for Medicare Advantage, basically, if I write somebody in the fall during the annual enrollment period, if I switch their plan, I get 100% of the annual commission in January because that's when it starts, January 1st. If they stay on that plan for the next year, I get whatever the annual commission is that year spread out over 12 months. And with most Medicare supplement companies, and it doesn't really matter what company you are, a plan G, for example, is a plan G no matter who you go with. The Medicare supplements are standardized by CMS, by Medicare. Whereas Medicare Advantage plans, they can vary on their benefits. A plan G is a plan G no matter who you go with. So at that point, it's really just premium shopping. With most of those, it's as earned commission, which personally I kind of like because it makes financial planning easier. If I can just look at my book of business and look at my commission statement, I'm like, okay, this is what I'm going to have for the next 12 months until the commission goes up or their premium goes up. But it's not enough of a difference and hopefully my clients know me well enough and trust me well enough to know that wouldn't make me choose one way or another anyway. Sure. Even if the commissions were a little bit lower on Medicare Supplement, which they're not usually, but I mean, it may be like within $10 a month for certain companies. But my Medicare Supplement clients are the easiest clients that I have to deal with because I never hear from them. And you only call your insurance guy when there's an issue. So if you don't hear from your clients, not that I don't love talking to them, but I've never called my State Farm guy just to shoot the breeze. You know what I mean? Yeah. I only call them when I have an issue. And Medicare supplements just are so straightforward that there's just no issues with them. Yeah. Whereas Medicare Advantage, and this is another funny thing about Medicare Advantage, this is why I'm not sad to see to be less about the extra benefits. 90%, I would say actually over 90% of all the maintenance calls I get throughout the year is about dental. Can I know who's in network? My dentist is saying they're not in network. It's like, yeah, because they decided they didn't want to be and didn't file the paperwork with the insurance company. So they're still showing up on the provider list. Or they're not paying this claim or, whatever. And that's a vast majority of all my maintenance calls are about dental.
If it's hard to pick a Medicare Advantage plan and it's complicated, like you have to really do a lot of comparisons and it can change from year to year. And you're not sure 100% how much denial rate's going on in the background or what's going to happen to that individual or how things are going to change or be, because those companies they're going to make changes. Yeah. And you don't typically get calls from your traditional Medicare and a supplement people, and you've got more stability there. Why do you think so many more people are choosing Medicare Advantage?
Monthly premium. A lot of people in this area just can't afford the monthly premium. Right. I mean, Medicare supplement companies are like life insurance companies. I could have you a quote for 100 different companies in 3 minutes and they're all going to cover the same thing. So at that point, you're just premium shopping. Right. And so I try to stay contracted with like the 3 or 4 that have the lowest rates in Southwest Missouri. Because anything else is just a waste of my time. You're not going to spend more on a plan G or a plan N when you could get it for this other company for $15 a month cheaper. And there are a few exceptions with that. There's one company that does offer silver sneakers with their supplements, which is not typical. There's another one that offers Renew Active, which is their own proprietary. It's like silver sneakers, just not quite as large of a network. But that's really the only extra benefits that any of those offer. That is really, so it's so interesting. I have a flow chart that I made for my clients. Something I can show them, but I can't send it home with them because of Medicare's marketing guidelines. I have a way of getting around that though. I just put it up on my smart board and I say, all right, I'm going to go get a coffee break. You're an adult with a phone on your camera on your phone. Whatever happens in here is not my concern. So that's how I get around that rule. Yeah, I guess if I go take a coffee break and whatever happens in there, it doesn't matter to me. Because it is confusing and it's a lot of information to go through in a short amount of time. If you're just coming to my office for the first time and you need to get on Medicare and, we have to sign you up for original Medicare. I have to explain that. Then I have to explain the difference between the two plans. It's a lot of information. Yeah. So I usually split up my, if you're coming to my office and you're new to Medicare, I usually split it up into at least 2 meetings. First to sign you up for Medicare, if I can. If you have my Social Security account, then I can help. If not, you'll just have to call Social Security. And we can't sign you up for anything until you get your card, or at least your Medicare ID number. So I'll do the very short version of the difference between the plans, but you're going to forget 90% of it or 80% of it anyway. So might as well save that for another appointment. So that's how I do that. But, a lot of people, there's 2 kinds of people that come in. Some of them have heard horror stories about Medicare Advantage and they don't want to talk about it. A lot of their fears are really unfounded. May have been true 20 years ago when Medicare Advantage first came out, because it was kind of a nightmare back then, but it's smoothed out to a certain degree. Now from the provider end, I'm sure you have a different perspective because you see a lot more problems than I do. In my experience, it works well enough to where most people are happy with it. So some people just don't want to hear about Medicare Advantage. And then another type of person I get is somebody that comes in and then they're comparing the two. I've written things up on the board and they're like, so this one over here, the Medicare Advantage plan, costs me nothing per month on top of my Medicare Part B premium, and I get dental and vision with it. Why would anybody go with the Medicare Supplement? And I'm like, well, there's a lot of reason I would say, but I try not to be the gatekeeper. I try to just give you the information and then let you go there. But a lot of people, they see that, if you're a male non-smoker turning 65, you're going to be paying another $175 a month in premium for a Plan G. And that's on top of the $202.90 Part B premium. And you have to add a drug plan too, which is minimum going to be $9.60 for this year. So they're like, I have to pay 3 premiums if I go this side, the Medicare Supplement side. And I'm pretty healthy, so I don't use the doctor. And so why would I not go with Medicare Advantage? Yeah, I get a lot of that. Yeah. And I mean, the logic there, I understand it. Of course, I make sure everyone is aware of Medicare Advantage plans. They don't ask you any health questions. Legally, they cannot. In fact, the 2 questions they were allowed to ask you, are you a smoker and do you have end-stage renal disease? No longer allowed to ask you either of those. Medicare Supplements, on the other hand, different story. There are three main guarantee issue periods where you get 6 months of guarantee issue, no health questions for Medicare Supplement. When you turn 65, when you get on Part B for the first time, and when you leave employer coverage. For most people, those 3 things happen simultaneously, but not everybody. And I make sure they understand that if you wait to get a Medicare Supplement, if you wait until you need it, it's too late. You're not going to be able to pass the health questions. They each ask about 20 health questions, and they are very strict. They're not legally required to take you. Like I had a lady just this last fall. She takes a blood pressure medication, and then something for her eyes. And she wanted to roll the dice and answer the health questions. They denied her. They wouldn't take her. But they're not legally required to take you. Right. And you can kind of understand why, because I'm thinking to myself, considering how much I'm paying on the marketplace for a family of 4, and I think, okay, I could get 100% coverage after my Part B premium or my Part B deductible and only pay like $175 a month. That's a good deal. But I'm also, I'm paying, an ungodly amount on the marketplace for my family. Yeah. And so for me, like, I have a different perspective, but from the insurance company's perspective, I'd be like, yeah, we are not charging enough premium if we're going to start taking on all these sick people.
Right.
So,
I think the thing that pops into my head is like, if my wife's about 8 years younger than me.
Yeah.
So we both went to go get life insurance at the same time.
Yeah.
You can imagine her premium is significantly less than mine.
Well, and she's a woman. So
yes.
Yeah.
And all the health questions and different things like that they'll put you through as you get older. Well, I can totally see why somebody healthy, 65, they may not even use their insurance that much, and they don't anticipate that. But from my perspective, from what I've seen from patients that have done this, the people who lock in with traditional Medicare and a supplement, they don't have to think about it. Mm-hmm. From that point on, they don't have to worry about 10 years, that insurance plan completely pulling the rug out from under them. Mm-hmm. They just know that until they die, as long as they pay their premiums, and yes, it is more expensive, but some people would argue that stability you're paying, that's what you're paying for, is to know you can go to any physician, any provider, and you're going to get the same coverage every year, year in, year out. And that I think some people don't know that when they make the choice for Medicare Advantage, if something progresses and they're like, oops, I think I need to go back to traditional Medicare and a supplement, those gates close sometimes for some people.
Well, and I would even say for most people, because again, if you wait till you need it, then it's too late to get a supplement. And I'm a similar mind of you. I'm of a similar mind as you. If somebody wants to do Medicare Advantage, great. I'm most of them, the vast majority of them are going to be happy with it. They're going to enjoy the extra benefits, and it's going to work fine. Especially if you die quickly. I mean, that's the morbid truth about it. Like if you have something that's going to cause you to die and you don't drag it out, if you die quickly, then you're going to have a much better time with it, as morbid as that sounds. But the phrase I like to use is for those that are thinking about Medicare Advantage, if I gather that they could probably afford it if they wanted, like if somebody was paying, $600 a month for their coverage through the marketplace, then they're going to be paying something comparable to that if you factor in the Part B premium and the Medicare Supplement premium and the drug premium, but they're going to get way better coverage. And sometimes though, they just see that premium, premium on the Medicare Advantage, 100%. And they just, they're going to be like, you mean I can get rid of this $600 a month premium and I'm healthy and I don't use it. So it's going to actually pay me money because I get dental.
Yeah.
I understand it. But what I always tell them is like, you need to remember that if you go this route, the Medicare Supplement route, even though you are healthy, you are protecting your insurability. That's the phrase I like to use.
Yeah.
And so we're a family business. It's my dad and his brother and I and our assistant. My dad's brother, he's over 70 and he's been in business for himself successfully. And he chose a Medicare Advantage plan because he's pretty healthy. And he's like, I feel like I'd be throwing away $2,500 a year in premium.
Yeah.
But by the way, those supplement premiums get more expensive as you age.
Yeah.
And then sometimes on top of the age-rated premium, an insurance company will decide we're going to raise our premiums by 11% across the board. And so if you are 65, by the time you turn 80, you can count on paying double what you were paying when you were 65.
Right.
And for some people, a lot of people, the dollars just don't make sense. They're like, yeah, we'll take it. I mean, we'll take the fight with the Medicare Advantage plan. And I'm just be honest, I get it. And my dad's the same way. On the other hand, I'm a Medicare Supplement guy. If I had to be on Medicare, I would do that. But I have health issues. And so I know my health is going to decline.
Right.
And really, that's the only thing we can count on with our health is that it's going to get worse.
Yes.
Eventually. If you're working class family and you're retiring and you got to watch your budget because you're on a fixed income.
Yeah.
Medicare Advantage gets attractive.
Oh man, it sure does. It sure does.
So do you think the premiums go up because as you age, you have more needs and all that?
Yeah.
Is that why the premiums go up?
Yep. Okay. Yep. That's why. And then the government really likes Medicare Advantage because Medicare Advantage historically has made the Medicare program look good, because up until recently, Medicare Advantage was more efficient at managing Medicare benefits than the government was. So that's why they like Medicare Advantage. That's why they're funding Medicare Advantage. And since so many seniors are going that direction, the number one way to tick off seniors is to mess with Social Security and Medicare. And seniors are the largest voting bloc in the country. So we don't have to worry about it going away anytime soon, which, hey, job security for me. But the government likes the image that Medicare Advantage displays because Medicare supplements are kind of becoming more of a luxury. It used to be the only option. If you wanted to have anything other than original Medicare until 2007, that was the only option. So the government is not supporting Medicare supplements as much as they are Medicare Advantage. And so as we age and as the life expectancy gets longer, I mean, think about this. When Social Security first came out, the average life expectancy of a man was 65 years old. Wow. The average life expectancy of a woman was like 67.2 years. Now, I don't even know what it is. I know it's not 65. I know women's is still longer because they generally make better health decisions.
I think they're in the 80s and we're still in the
They're smarter than us.
Yeah. Yes. Yeah. I could name you all the reasons why white is going to live longer. We could sit here and make a list. But her drug of choice isn't Diet Coke like mine is. It's just Medicare in general and Social Security in general is becoming more expensive to fund.
Yeah.
And so that's why I'm really glad that even though it may cause some disruptions for me in my compensation, I'm really glad that the government is cracking down on fraud, waste, and abuse in the Medicare system, but specifically the Medicare Advantage system, because there's just no reason for it. If you're going to take away these benefits and be stingy with prior authorizations, yet you're, wasting all this money, that I have zero sympathy.
Yeah.
Sympathy for you. And I understand that, healthcare spending has been outpacing the consumer price index for who knows how many years now. I think it's something like 3 or 4. But it's not an issue with insurance companies alone. It's a systemic issue that, and don't get me wrong, I'm all for market-based healthcare because I think that's how we remain efficient, we remain innovative, and that's how we can continue to be the beacon for the world to let them look at what we're doing and copy it. But we have simultaneously the best and the worst healthcare in this country because if you can access it, it's great. But it's expensive to access. The hospital systems, they keep inflating their prices. And they keep blaming it on insurance companies. But for me, it's like, look at what's happening on college campuses now. What was tuition back when our parents went to college? They could afford paying their way through school by working part-time in the summers or working full-time in the summers, part-time through the year. But the reason it's so expensive now is because the schools realize that they can get all of these kids that have no money sense to go take out tens of thousands of dollars in high interest debt without knowing the consequences. And they can charge really whatever they want and take on all these new building projects that justify them charging more. And there's a rule in economics that anytime you have if you have a product and you have a third party with an enormous wallet helping pay for that product, you can charge whatever you want. And I get it from the provider's perspective, from the hospital's perspective. I get it from the insurance company's perspective. They're both looking out for themselves, for their interest and their employees. But it's like, all right, we need to get a fix here. And in my opinion, and they didn't ask me my opinion when they set the system up, probably good because there's a lot I don't know. But I think health insurance should work like car insurance. where the industry is deregulated enough to where I honestly, I don't think there's any reason that you shouldn't be able to pay cash for a primary care visit or blood work. I think that should be, we know how it works well enough. There should be enough red tape out of the way that it's cheap. The providers don't have to spend money on administration for those. And the insurance company does not need to be involved in that. I don't think. Like when I go to the mechanic to get an oil change, my insurance company has zero part in that because the government's not involved in it and it's cheap. It's cheap enough to where I can pay cash. And do I want to do it every month? Do I want to pay $60 to get an oil change every month? No, I don't. But every 6 months, it's relatively affordable. Do I want to pay $1,000 to get my tires changed every 5 years? No, I don't. But if I know it's coming, there are very few people that can't do that if they know it's coming and they know to plan for it. But if all of a sudden I, knock on wood, get lung cancer, like in Breaking Bad, then yeah, that's when I want my insurance to step in. And that would cut down on administrative costs because the main three reasons that healthcare is so expensive is, other than the provider issue we talked about, but the providers have good reason to justify raising their prices because they spend so much stinking time in administration dealing with the government and dealing with insurance companies. Overinsurance is a huge problem. I have a family, they're hospital administrators. I won't say for which hospital, but they're not Medicare Advantage fans. And I'm like, I get it from your perspective, but also like, you're charging $5,000 for an MRI and expecting the insurance company to pay for it. And you don't expect pushback on that. Yeah. I mean, let's be realistic here.
Yeah. Yeah.
So
many Medicare Advantage plans advertise $0 premiums with extra benefits like dental and vision, as you mentioned. What trade-offs should seniors understand before choosing those type of plans?
Well, again, I would say the network issue is the main one. And then the fact that they change every year. Usually they're not big changes, but if it's the last 2 years, yeah, they're big changes because the Inflation Reduction Act, that's still phasing in. Those rules are phasing in. And we're in kind of a period of market correction, I think. So I'm hoping that things will stabilize once the insurance companies figure out how to become profitable again with all these new rules. But the network thing is the big thing that I would point them to. And the fact that if they don't choose Medicare supplements, the insurability issue, the guarantee issue period, if you don't choose it now, when you turn 65, then you're not going to be able to get it later, probably.
How should seniors think about out-of-pocket risk when it comes to Medicare Advantage versus traditional Medicare?
Well, if you're talking strictly traditional Medicare with no supplement, then you're risking a lot of out-of-pocket costs with original Medicare. Because again, let's imagine let's imagine you're on a cruise and you have a heart attack and you have to be airlifted out. They're going to charge you $10,000 just for turning on the engine of the helicopter. And flying you there and then flying you back. I would not be surprised to look at a $300,000 bill.
Wow.
It may be less than that, but if you showed me a bill for that was $300,000, I would not be surprised at all.
So don't do Medicare with traditional Medicare without a supplement.
I would not recommend.
Don't ever do that.
I would not recommend.
Okay, we got that down.
Yeah,
fair enough.
I would not recommend it, or at least if you do, buy travel insurance. If you're going to do that, right?
But if somebody went to the hospital and they're on Medicare Advantage, are there charges or things that may be behind the scenes that they're not aware of? And when they get in those catastrophic situations where it may be a long hospital stay, a long skilled stay, that they need to be aware that could be there.
Yeah. So if we're talking strictly inpatient hospital, if you're going to stay like 60 days in the hospital, it would be better to be on original Medicare, Part A, because the only out-of-pocket cost you have for the first 60 days is like $1,700 and some change. And that's a per benefit period deductible. So if you get out and go back in after a certain amount of time, you'd have to pay that again. But under a Medicare Advantage plan, if you haven't hit your max out of pocket yet, you would pay, let's say, $400 a day for the first 6 days. And, obviously that's more than $1,700. And as far as the days go, Medicare Advantage plans, they say they cover an limited amount of days in the hospital. I've yet to see anybody stay past like 2 weeks, because let's be honest, the hospitals are going to try to send you home as soon as they can. There are a shortage of beds, and if you need care that badly, they're going to send you to a long-term care or send you home with home health care. Try to, at least. There are a few areas where I would say it's clearly better to have a Medicare supplement than a Medicare Advantage plan. And one of those is skilled nursing. And the other two are home health care, like you guys do. And then physical therapy. Because yes, Medicare Advantage plans cover that. It's just getting them to cover more days. Like the story you told earlier. That's the trick. And so they're going to fight you on it. It's after 2 weeks, really, it starts costing the insurance company more money. I think because I rarely see them want to pay for more than 2 weeks. And on all the summary benefits, the per day copay is like either 0 or 20% up to 20 days. And then you start getting into larger copays. So there's something about that magical number, 20 days for skilled nursing, that I don't really know about, but I'm pretty sure it costs them more money. So that would be another caution that I would have. And another area where I would say it would even be better to be on original Medicare with nothing.
One of the things I'll mention, and I think sometimes this is what happens sometimes when they go home quickly from the hospital and they needed to stay longer. Yeah. Sometimes that does get limited sometimes by the Medicare Advantage itself.
Yeah.
They'll go into a facility. Sometimes they can't pick which facility because there's a limited network, but they go into a facility, and sometimes that facility is limited to the number of days, even though they would normally have kept that person longer. They have to send those notes into the Medicare Advantage. Yeah. The Medicare Advantage says, okay, they're done. They're going to be discharged. So what happens is that somebody who has traditional Medicare and a supplement winds up staying in the hospital slightly longer if it's serious, and in the skilled facility slightly longer. So what happens is that when they come to us, which we're kind of the last stop, so to speak,
right?
We're seeing people that are in way worse shape, that are on Medicare Advantage coming home, and so because of that, and sometimes we're limited in how much, as I described earlier, how often we can see them. And in some cases, they need somebody in that home daily.
Yep.
And the insurance isn't going to cover that. They're just like, no way. Yep. So they end up going back to the hospital more often. And you're like, how does the Medicare Advantage not know that by saving a little money on the front end,
it's very short-sighted.
They're actually charging 10 times more to that. I mean, just if you're just looking at it from a dollars and cents standpoint, there must be something else going on behind the scenes that I'm not seeing that tells their actuaries or whatever to say that's the best way to do it, because maybe in the long run you have a higher mortality or something. I have no idea. The logic doesn't make any sense to me when I see that.
I would be surprised if there's no logic behind it at all, and it's just short-sightedness.
Oh, good.
I'm not saying that's what it is, but I'm just saying it wouldn't surprise me. It's really funny because we love most of our broker reps that are like the intermediaries between us and the insurance company. And so they work for the insurance company. Their job is to manage us, the individual brokers, and they'll tell you the same. I mean, they'll say more diplomatically because they're employees, but they'll say, yeah, this is freaking dumb that we do this. So that, in fact, that one company, one of the employees that is a broker manager, we were, because they had one of the plan that if you were on Cox, the plan that everybody wanted this year. Our broker manager said, yeah, we all know the game they're playing. We all know what's happening. It's dumb, and it's going to kick us in the butt, but it's dumb. We all know, because we think that they have been around for a long. And I actually do like their philosophy. They were a brother, actually two brothers, I think, and they were both doctors, and they saw how the Medicare Advantage plans were treating their parents, and they didn't like it, so they started their own. And so almost every state that they've been in for long enough to have a star rating, they've had a 5-star plan, is my understanding, which is great because Missouri currently has 0 5-star plans. We haven't in like 3 years. So when we did, we only had 1.
Yeah.
And so we had high hopes for them, but we just think they tried to buy up too much business, and that next year their plan is not going to look good, but they know that enough people won't switch away that they'll be fine. And we think they just got too big too fast. And because I think they moved into like 11 states for 2026, and that's too many states for a company that size to move into. I forgot where I was going with that, but it's really, really short-sighted, I think, because you probably didn't, you may have known about this benefit that most of them offer, but this is why what you just said is hilarious, because they will offer a meal benefit for people right after they get out of the hospital or skilled nursing. Like they will deliver meals to their home to try to keep them out in the hospital. And I'm like,
here's some DoorDash.
I'm like, they contract with local vendors. It's like a Meals on Wheels thing. It's just not Meals on Wheels.
Okay.
And I've heard they're also terrible with most insurance companies. They're like lean cuisine, frozen. And I actually, my neighbor was a client, and he let me try one, and I'm like, yeah, this is gross. It's edible if you have a generous definition of edible. And who knows what chemicals and preservatives are in it. It's probably like, if you stay on it, if you eat those exclusively for 10 years, you'll probably have, 12 different kinds of cancer. But
back to the hospital.
Back to the hospital you go. Them showing like, yeah, we want to pay for that. We want to pay for dental because we know that heart health is closely linked to dental health. And we want to pay for silver sneakers because we want to get you out of the house. But if you have to stay longer than 2 weeks in a skilled nursing facility,
Yeah.
So I'm with you, man. It just seems so short-sighted. But see, here's the thing that I wish that like specifically for things like skilled nursing and home health care and inpatient hospital, the providers could make a deal with the Advantage companies. Like, okay, look, we'll charge you less for these specific benefits. We can have even a 50%, whatever they need to still remain profitable. We can give you a deep cut contracted rate on these benefits. Just don't freaking fight us when we say this person needs this amount.
Yeah.
That to me seems like, and again, I'm not the numbers guy for any of these, the providers or the insurance companies, but to me, that seems like a really reasonable compromise.
Yeah.
And so
unfortunately, they're getting it on both ends because we're negotiating those contracts just as much as those skilled nursing facilities are. And they'll all tell you that they're taking a 50% cut off of what Medicare pays them just to be able to contract with them because there's enough market here. Mm-hmm. And then on top of that, they get less volume, less days, less visits, whatever. And so they're really squeezing the provider as hard as they can. And that's, as much as people want to say the healthcare system is broken, what they mean is that we've got way too much greed in this system. I mean, it's just greed is built in at several different levels. And, what's bad is that these huge healthcare organizations own everything.
Yeah.
They even own competitors in our area here. And so, when you really step back from it, I think there was this big push in the early 2000s to consolidate. Yeah. And they're like, bigger healthcare is better. Mm-hmm. And the bigger you get, the better you're going to be able to manage things and manage costs and different things like that. And all it's done is offer more opportunity for people to scrape a cut off of that pie. Yeah. And so many layers are taking pieces off of that. And by the time it gets trickled down to the providers, there's hardly anything left. And so, and the problem is that, when you take your car to a mechanic and you consistently, your car breaks down on the way home, like you're going to stop going to that mechanic, right? Well, healthcare is not that cut and dry. Right. And most people don't know what good care is. They know what good customer service is. They know how that interaction was positive, so they feel good about it. But the reality is that we don't have great systems to say what good quality care really is. And not saying that they're not there, they're just not there to the degree that really has an impact overall on the healthcare system. Yeah. And so when they talk about the fraud and abuse, like 20 years ago, they could have easily dumped a ton of money into having surveyors that go in and not only check if you're safely seeing patients, because that's what they do right now, but they could dig into the billing and say, does these people actually exist or not? Are these people actually getting service or not? They could have really invested in investigators to really hold providers accountable. And so, of course, there's lots of fraud and abuse because they didn't have good systems. They don't have good accountability systems in place.
CMS tried to do that with the star rating system, but it's basically all provider and member based. There's nothing there's nothing inside looking inside. And maybe we need to do that with providers too, have a star rating system that is not just on the member side, but also on and I hate to say we need more bureaucrats, but maybe that is what we need in this situation here. And I also think maybe it would be a good idea to re-examine antitrust laws in healthcare. That might be a good compromise too. It's just, but you mentioned the mechanic metaphor, and it's like, and you've got 10 mechanics within 5 square miles you can take your car to, 10 competing mechanics. And here, you have Cox and Mercy, and that's it, really. Yeah, I mean, you can go up to CMH, but I see a doctor at CMH, and they've been great, but they use both Cox and Mercy's network. So it's so hard. Like, even if I was an investor and I wanted to invest in building another healthcare facility, I wouldn't know where to begin. Yeah, I mean, you need a really good in with that kind of thing. It's not just hey, I know a few guys who are good doctors, and I know a guy that's a good businessman. Let's start another hospital because we see what's wrong. Right. No, we need a 10 compliance guys just to make sure we're complying with government. Yeah. And not in the good ways, all in the weird little red tape rules that honestly probably amount to next to nothing. Yeah. But not in the important ways, like, okay, we need to have transparent financials, and the insurance companies do too. Right. And on the insurance company side, that's why I'm really glad that that's starting to happen, because we talked about Medicare scams when I first sat down, and this was kind of funny. If it wasn't actual reality, it would be funny. We had a client come in, and somebody had gotten his Medicare ID number. He talked to somebody on the phone, and they got his Medicare ID number. But instead of switching his plan, since Medicare's, these scammers are just so ingenious that if they actually put it towards something productive, maybe the world would be a better place. But some of them have started to learn that, all right, we can't switch their plans as much because one insurance company has gone, they don't allow electronic enrollments anymore. It's back to paper because their star ratings were tanking because people got on their plans. They didn't know how. It's because of these call centers. They would enroll people electronically over the phone. And another company, they did not allow any RX plan enrollment over the phone or online anymore. You had to do paper applications. So now that that's happening, they're switching to a different tactic, Medicare claim scams, which, the health claim scams have been around forever. But in our area, at least, Medicare seems to be kind of new. We had a client come in and said, yeah, I got this explanation of benefits from Medicare. Somebody had ordered $13,000 worth of catheters and sent it to my house. Oh my God. $13,000 worth of catheters, which, the way prices are inflated was probably like 8 catheters, but you know what I mean? Yeah. On a Saturday, these just showed up, and I got to tell you, that's not my idea of a fun Saturday night. And it's just, it's crazy. At some point you can't regulate and control human behavior. You just have to put enough, you have to decentralize it and just put enough safeguards into where we understand people are going to do harm. Let's just try to minimize that harm.
Yeah.
You know what I mean?
Yeah. But going back to what you're talking about with the insurance, you're like, well, I'm a local guy and you can come to me because I'm local and I live here and my customers are going to know me. And if I do bad things, I'm going to stop getting business because everybody's going to know it.
Yeah.
And that's kind of the big push that we're trying to get out there, I guess, is that there are local providers and there are local insurance guys that are going to not turn you in the wrong direction because they know you're the one who's going to have to pick up the phone and deal with the complaints and the issues that come up later.
Yeah.
And so it's in your own best interest to make sure you're putting them in a decent plan because it's your reputation. And I think sometimes that it's really hard to tell if somebody's local. I used to go to a dentist and that dentist got bought out by a private equity group and they changed drastically. And pretty soon I would go in there and they were trying to sell me everything under the sun because it was their business model. Okay, but it just changed, So I went from having no cavities to 30 cavities, and I'm just like, okay, I can't do this. But the idea of buying local, I cannot think of any area that needs to focus on that more than around healthcare and insurance and that sort of thing, because people just don't know. There's just so many pitfalls out there, so many scammers, and even the biggest boys are unfortunately sometimes the worst because they use these third parties. They feel like they have and it's just a money grab. Yep. And they're not going to have to deal with that person ever again.
So. Well, we were told several years ago around the pandemic from one of our broker managers. And again, these guys we love most of them because they're honest with us about the company that they work for. And because we were asking, like, how can this call center get away with this Joe Namath commercial? Because I could think of 3 different compliance rules that one commercial breaks. And like, for example, that one, they had like a Medicare card on the screen or what looked like a Medicare. It was different enough, but you cannot use that in marketing. You can't use the likeness of a at least you couldn't back then. It may have changed. I don't know, but you couldn't use it back then, at least on TV. And they said, or he told me, he's like, look, CMS doesn't have the manpower to police these, and the insurance companies aren't going to self-police because they do not care how the applications come in as long as they're not getting complaints. Now, they will send out secret shoppers to sales events. I've been secret shopped a couple times. And they're usually pretty obvious. Like they're somebody in their 30s or 40s that are saying, yeah, I'm shopping for my mom. And so there's something we have to get signed before we can talk about benefits called the scope of appointment. It's not binding. It says you understand that I don't work for the government and that I can only talk to you about Medicare Advantage plans today. Because cross-selling is illegal. Like we can't talk about Medicare Advantage and life insurance in the same meeting.
Right.
We'd have to schedule a separate meeting for that. That's what the whole point of the scope of appointment is. And so whenever I suspect somebody being a secret shopper, I just say, great, I'd be happy to walk you through summary benefits and explain the star rating. I just need you to sign this first and tell them what it's for. And they usually don't want to sign it. I'm like, sorry, I can't tell them, because that's one of the things there's policing is like when you tell me benefits before signing them. And like, if they don't want to sign it, I'll say, all right, well, can't talk to you if you don't want to. So that's really the only self-policing that they will do, is that they will send out secret shoppers. But that's really it. These call centers are bringing in a lot of business, but that's changed a little bit because the star ratings are starting to go down. And CMS, they've made the star rating system a lot more strict in the last couple of years. That's why we don't have a 5-star plan in Missouri anymore, because a lot of the insurance companies have lost half a star rating, or half a star rating. And the star rating is a big deal because the higher the star rating, the more money you get from CMS per member per month. And we have an amount that, I ask, the insurance companies won't tell us how much they make per member per month here. And it varies depending on, if you're dual enrollee on a dual special needs plan, they get more. And if you're on a CSNP chronic special needs plan, you get more. And certain counties get different amounts, but we think it's about $1,100 per member per month here just for a standard Medicare Advantage plan. And so they want the healthy people, obviously, because the less they have to pay on claims, the more money they're making per month. And what they do is they take that money, and just like any other insurance company, health insurance company, they invest it in low risk but high turnover stocks, usually, and bonds. And they put that in a trust, and that's how they pay claims.
Yeah.
And so the more money they can invest, and something like 85% of that they get per month has to go back into plan benefits. Right. So they can't, that money has to be for plan benefits. So anyway, the point is they don't care about how those apps are coming in. They are now, at least because of the star rating system. When the whole marketing kind of changed up because the pandemic forced that, where they had to market or advertise over TV and phones, which they were doing a lot of cold calls, which you were not allowed to do for Medicare Advantage or prescription drug plans. Supplements, you can do it all day long. You can go knock on doors down the street, but you cannot do that for Medicare Advantage or drug plans. But they started doing it, and the insurance companies looked the other way because the apps were coming in. And, it was COVID and a lot of claims were being taken out, so they didn't really care. But now that it's starting to affect their star ratings, they're caring now.
Yeah.
Which I'm glad. They should have cared from the beginning. But
the only problem that I have with the star rating, the way it's set up right now, is that it's usually 2 years old. Yeah. And that, they don't really factor in denial rates or, delays of care or, kind of service type that most providers would probably put top of the list of the issues that they might have with a Medicare Advantage plan. And because they don't put that in the star rating, it kind of takes out, some of the meat of what is really going to tell them whether that's a great plan or not.
Well, the beneficiaries don't know that that's an important factor. And you're right. Like a lot of it is based on, customer experience, how fast they're paying out claims, at least in the customer's view. And plan benefits just in general. But that is something that they need to know because, like you said, if the provider if you have to fight for every claim, and my chiropractor, I'm close with him. He's used to be a police officer here in Ozark. In fact, he pulled me over once right over there as Leo Star from this theater.
You get an adjustment real quick.
I just seen Star Wars Episode 7, and it was at night, and I hadn't turned my lights on, and my mind was still comprehending the movie I just saw. I'm a huge Star Wars fan, so I was still processing. And he pulled me over, and I was seeing his dad at that point, so he didn't recognize me. He was like, "Hey." I was like, "Hey, you want to turn your lights on?" I was like, "Oh yeah, okay." And then I started going to him because his dad passed away, unfortunately. And I was like, "Oh, hey, you're a police officer, right?" He's like, "Yeah." I'm like, "Oh, well, you pulled me over 3 months ago." But about that new company, he has had just a heck of a time with them.
Yeah.
He said that they always say that they filed under the wrong code. And he's like, "We're a chiropractor. There's only like 3 codes we can file under."
Yeah.
And there's a whole story there that I won't go into, but they did something really weird. They called a customer that was having a claim issue, and this customer service rep said that my chiropractor's office was being rude. You don't ever call the customer, the client that's having a claim issue, and especially not to tattle on the provider and whine about the provider's office. And I know the lady that calls about claims, she doesn't have a mean bone in her body. She's she's just this sweet, tiny little, millennial. And it's like, come on, guys, get real. But yeah, so I have no problem believing that you guys had issues with claims and customer service with them.
Definitely.
So yeah.
When a patient or family believes care is being denied too soon, what rights do they have to appeal that decision?
They've got every right to appeal. I think it's with each insurance company, you've got, I want to say 30 days after the bill has arrived or after the denial letter has arrived. I may be wrong on that. I would need to look it up. But yeah, you can appeal, as far as I know, as many times as you want. And the thing I always tell them is, get your provider to, sometimes the doctors don't know really how to manipulate the insurance companies, but their office does. And so I would say, get your doctor to write them a letter and make it sound like it's going to be cheaper for them in the long run, because that's all they care about.
What might a denial occur initially if it later gets overturned?
The number one thing that I see, well, I'll give you an example, a recent example. I have a guy that's on an insurance company that we really like and that historically has been easy to work with, that they've been in this area forever. And he needed surgery on his knee. And the insurance company told him, well, no, you need 2 weeks of physical therapy first. Oh. And he's like, I can't move my knee. I can't walk. So physical therapy, like this is past physical therapy. Like, this is scar tissue here that needs to be fixed. And his doctor made that case, and we called the insurance company and appealed it. And they said, nope, need 2 weeks of physical therapy. And it just took us getting that one customer service person or that one appeal person to look at his file and look at his claims data and say, oh, okay, yeah, we'll approve this.
Interesting.
Yeah.
For families listening today, what practical steps should they take if a loved one is being discharged from rehab or a nursing facility sooner than expected?
That's a good question. One of the first things that I always tell clients to, and this is when it comes to claims issues that are non-dental related, because those are most of the calls I get are about dental. This would be number 2, skilled nursing.
Okay.
What I would say is that, first of all, throw a little bit of a fit and make sure you're seen throwing a fit, because the more pressure a lot of times the providers want to help you, they want you there just as bad as, you want your, whoever you're giving care to there. File and call the provider or call the insurance company as often and as, I don't want to say be rude, because it's not the person you're talking to fault. It's not their fault. They just are doing their job. And make sure your anger is not directed at them, but make sure they are uncomfortable enough to get a supervisor.
Okay.
And the more you can do that, the more likely it's a classic case of the squeaky wheel gets the grease. Mm-hmm. And be the squeaky wheel. That's what I would say. And have the doctor make it very clear that is in the insurance company's fiduciary interest to keep you there for however long you need.
What about snowbirds? And they got to go to a different area of the country. Do you have any issues with them getting coverage?
On Medicare Advantage plans, it depends on the plan, but for all of the plans, you are covered in network for emergency care and urgent care. It doesn't matter where you are.
Okay.
You worldwide. Now, I wouldn't go to Syria and try to use your Aetna card, but a lot of times what happens there, you'll have to pay for any services that you acquired and then just settle up with the insurance company when you get back stateside.
Okay.
So make sure you get a bill.
Okay.
In English, preferably, but
so they will cover it if you're overseas. Mm-hmm. Wow. Yeah. That's incredible. But if they're, let's say, I don't know, they go to Texas every year, or Florida every year, or for a few months or something, and they need more, well, even though they're out of network, will it still cover it?
So that's kind of a tough issue because it depends on the insurance company.
Okay.
There are a couple companies that have nationwide networks. So there's 3 that come to mind. I will go ahead and name those. It's Humana, Aetna, and United Healthcare that have more or less nationwide networks on most of their plans. So as long with those 3 companies, as long as you are seeing a provider that is contracted with a like plan in that county, then you can use them like in network. So for example, if you were on a Humana HMO or Humana PPO, that was part of the nationwide PPO network. If you are in a county that's seeing a provider that's contracted with a Humana PPO there, then you can use that plan and pay there what you would pay here. So even if the provider or the specialist copay is $100 where you're at, the plan there charges $100. The Humana plan there charges $100 for specialist, but here it's $40. You would pay the $40.
Okay.
Yeah.
Okay.
It's the same copays as you would have here.
Okay. What advice would you give adult children who are trying to get their parents in the right plan? We get a lot of calls like this from kids who are like, I don't think mom's in the right plan, is it just call you, or what's the...
I mean, obviously I'd like to say call me, but, if you have someone else you trust that does what I do, call them.
Yeah. Are there any state organizations that are kind of like unbiased?
Well, there is senior age, and they've got, I think it's something like 40 senior centers in Southwest Missouri. And they will actually send you to me, or they've got a short list of agents that they trust that they will refer people to.
Okay.
And I'm on that list.
Okay.
You have to prove that you are trustworthy. Like, they won't just put any agent on that. So
yeah.
It'll be, if they hear any complaints, they'll take you off the list. Okay. So you can trust that whoever they're going to send you to is trustworthy.
Okay. And if someone listening today is already enrolled in a plan and isn't happy with it, what are the steps they can take to make changes?
So we're actually if you're on a Medicare Advantage prescription drug plan, we are in another enrollment period right now till the end of April. Medicare reinstituted what's called the Medicare Advantage open enrollment period. It was like 5 or 6 years ago that they reinstituted that, but it is January 1st through the end of March. And you can make one plan change to a Medicare Advantage plan for an effective date of the first of the following month. So if you make a change in January, February 1st is your effective date. If you make a change now, it's March or April 1st, sorry. Mm-hmm. It's like coverage to like coverage. So if you're on an MA only plan, Medicare Advantage only with no drug coverage, you can't switch. Or if you're on a drug plan only in original Medicare, you can't elect to a Medicare Advantage plan. Mm. But if you're on a Medicare Advantage prescription drug plan, you can switch to a plan with a different carrier right now. If not, you can look and see if there are any disaster special enrollment periods, or a state of emergency and special enrollment period is what it calls. So like a lot of times if we'll have a tornado anywhere in Missouri, they will issue a special enrollment period where you can switch to a different plan. Okay. For a set amount of time. Or if you have a qualifying event like you move or really, that's really the only main one that I could think of that would be applicable here. You can switch to a different plan. If you have a chronic condition like a heart issue or diabetes, there are chronic special needs plans that you can roll in, and there's a continuous special enrollment period for those around the year. There is also a 5-star special enrollment period that unfortunately does not apply to us anymore, but it's where if you have a 5-star plan in your area, you can enroll in that 5-star plan year round. But aside from those special enrollment periods, get in touch with somebody that can help you for the next fall. The annual enrollment period is October 15th to December 7th, and there you can make any kind of change you want. I do need to point out, though, on the Medicare Supplement side, because they're a lot more strict. In most states, the Medicare Supplement you buy, that's the one you have forever unless you switch to an Advantage plan. In Missouri, we are one of only a handful of states that has an anniversary rule. So if it's within 60 days of when you signed up for your Medicare Supplement, you can switch to a like plan with no health questions just no health questions. So let's say that you're on an Anthem Plan G and Cigna is $20 a month cheaper. If you signed up April 1st, then between March 1st and the end of April, you can switch to Cigna with no health questions.
And we've had a lot of people ask this when they've had some trouble with Medicare Advantage. Mm-hmm. They wanted to get mom or dad back on a traditional Medicare with a supplement. Most of the time they've said what they've been told is that's impossible. Mm-hmm. Is that your experience?
If they're receiving care here, probably. Yeah. Okay. Unfortunately, it is. That's why Medicare Advantage, again, works for most people, and it's the overwhelming majority of my book of business. But I always, make sure people understand that, especially if they have health issues, this is your last chance. It's now or never.
Right.
And a lot of times, if people just sign up for Original Medicare through Social Security office, they don't tell you that.
Yeah.
I mean, but they're not trained to know that.
Right.
They're trained to fill out the application. And a lot of times there will be certain insurance companies that have contracts with the state for drug plans. Here it's, I'm not going to say the insurance company's name, but we do too. And so if you sign up for Original Medicare through the government, they'll give you the option. Do you want to sign up for Part D? Part D is like Medicare Advantage. There's no government Part D. It's all administered through health insurance companies. And so they will put you on that one company through the state, or that they have the contracted with the state. And so that's the extent of their Medicare knowledge, usually.
If somebody could take one takeaway from this whole podcast, what would be the most important message you'd like to get across to people?
Never hurts to have too much information. And make sure you got someone you trust. That would be probably the main thing that I would say. And if you're on a Medicare Advantage plan, pay attention to your annual notice of change. You get it every September. They're legally required to send it to you, and it tells you what's changing, what it was this year, what it's changing to next year.
Adam, thank you so much for being here. We'll make sure and put your information in the show notes. Okay. So if anybody out there is needing Medicare advice, please reach out to Adam. He's a great resource, and we really appreciate him being here. Again, for those of you out there, please like and subscribe. Rate us 5-star on your podcast platform of choice. And please, if you know someone who you think is dealing with some of the issues that we're covering, or they have a mom or dad or grandma or grandpa, please forward this podcast on to them so that they can benefit from it. Thanks so much.
If you enjoyed today's conversation, make sure to like and subscribe so you never miss an episode.
And we'd love to stay connected. Follow us on YouTube, Facebook, and on Instagram at In Good Company Elder Care Podcast.
You can also find us on X, formerly known as Twitter, at IGC Pod, and on TikTok at IGC Elder Care Podcast.
Thanks for tuning in to In Good Company. I'm John Ray, and I've been joined by my amazing co-host, Spencer Ernst. Special thanks to our executive producer, Alex Wallace, for helping bring this show to life. Until next time, take care, and remember, you are always in good company.